After my surgery, I waited a little bit, and I think it was around the 8 week mark, 9 week mark, and we got a scan. And the scan showed everything looked great in the surgical site, and everything essentially looked the same. And then following that, I requested a PET scan to really look into the nitty gritty uptake area, and it found nothing. So I'm currently no evidence of active disease. There is no evidence on my scans that I have disease anywhere, which is phenomenal and an amazing place to be at. But of course, I'm still cautious, right? So, what is my plan moving forward? So, normally people get scans around every 3 months, and kind of rely on those scans for checking to see what's going on. And I've kind of gone down a little bit of a different path. And every single case is different. Every person is different. So please don't take this as this is what I should be doing. Please talk to your doctor on what is best for you. But for me, for Samantha, what I'm currently doing is I'm getting blood work every single month. I am looking at different inflammation markers, different cancer markers, which for me in particular are highly accurate. For some people with lung cancer, they are not accurate at all. So, again, talk to your doctor. On top of that, I get a test called Tempus Personal DX ctDNA. It's similar to Signatera, which is used often in early stage cancers for looking at whether they're in remission or if the cancer is coming back. So when I had surgery, my oncologist submitted tissue from my surgery to Tempus. And now, every month, they do a blood draw, send it off to Tempus, and essentially they're looking for the ctDNA from my surgery tissue in my blood. So, is anything shedding dead cancer cells into my blood? And they can get very, very granular. We're talking parts per million. And so right now, I am at 3 parts per million. Before my surgery on Enhertu, I was 9 parts per million. I went up to 13 parts per million after my surgery, which makes sense because when you take something out, things start to shed and dead tissue is processed in the blood. And then I went down to 9, down to 3, and I've kind of been going between 3 and 4 for the past couple of months. And, trends are good. So once we see a uptake, which I hope is not for a very long time, once we see an upward trend, we need to make a decision on what's our next movement. And the benefit for me personally on this Tempus test that I do is that we can know a lot ahead of time in regards to what the cancer is doing. Are there cancer rumblings going on way before a scan will even tell you? So now I have Tempus anxiety rather than scanxiety because I know we're more likely to catch something early on in these blood tests than the scans. Although it's not 100% perfect. If things evolve and change, they're not going to catch it because they're pulling from my surgery tissue and there's expectations and certain markers that they're particularly looking for. Again, that's personal to me. We're making decisions early before things are shown on scans. There are many pros and cons of that. Doesn't work for everyone. It might make people more anxious. A lot of oncologists say at stage 4, what's the point? For me, because I have multiple options in targeted therapy for HER2, which I'm very grateful for, it means we can start to do combinations, maybe increase doses, all the things before anything is shown on scans. Again, that is personal to me. I get brain MRIs every 4 to 6 months. I never had brain involvement, but I want to keep on top of that and make sure that I catch anything super early. My scans are every 9 weeks, not 3 months. Again, that's just a personal choice. I want to get ahead of things. My scans alternate between CT and PET scans. So one 9-week mark, it's a CT. The next 9-week mark, it's a PET, and we alternate. Again, the reason being is I want to catch anything super, super early. While again, this Tempus test will help a lot. You never know what it might not catch. And so I really focus on the alternating PET CT. So, there could be things that start to have an uptake on the PET scan that haven't grown yet. I want to catch it then so we can radiate, surgically remove it, do something to it before we see it grow on a CT scan. So that is what I'm doing. It's probably overkill for a lot of people, but I am really in the weeds. I'm into the data, and I want to know as soon as possible if there are some rumblings going on.